So, I've been thinking about why some people decide to remove their breast implants.
Really? What's prompting that thought?
Well, there are 6 main reasons, and I thought it'd be interesting to discuss them.
Absolutely.
First up is capsular contracture.
Capsular contracture? That's when scar tissue forms around the implant, right?
Exactly. It can cause the breast to harden or change shape.
Right.
It affects up to 30% of patients, which is quite significant.
Wow. I didn't realize it was that common. Do we know why it happens?
The exact cause isn't fully understood, but possible factors include minor infections leading to chronic inflammation or an abnormal scarring response, kind of like keloids. It's like the body overreacts.
So if someone develops capsular contracture, what's the solution?
They might need surgery to remove the implant and scar tissue. Sometimes they'll replace the implant. Other times, they'll leave it out.
Got it. What's the next reason?
Implant rupture or leakage.
Oh, of course.
Over time, implants can weaken and break.
Does that pose a health risk?
Well, with silicone implants, the silicone is usually contained, but it's still recommended to remove or replace the implant.
Makes sense.
With saline implants, you notice immediately because the breast deflates.
So regular imaging is important to catch silent ruptures?
Exactly. MRI or ultrasound can detect issues that might not be obvious otherwise.
Right.
Early detection is key.
What about breast implant illness? I've heard some debate about that.
Yes, breast implant illness, or BII, is when patients experience systemic symptoms like fatigue, joint pain, and brain fog. It's not officially recognized as a medical condition, which is where the debate comes in.
Do people actually feel better after removing their implants?
Many report significant improvement in symptoms.
Interesting.
But it's complicated because symptoms are subjective and can have multiple causes.
Right, correlation doesn't necessarily mean causation.
Exactly, but if removal helps, it's worth considering. It's about patient
Agreed.
well-being.
What's next on the list?
BIA-ALCL, a rare lymphoma associated with textured implants.
That's concerning.
It's important to note it's very rare, though.
Still, even a small risk can be alarming. Do you think the media exaggerates this risk?
Sometimes, but it's crucial to have accurate information.
Absolutely.
Patients should discuss risks with their doctors to make informed decisions.
So some people remove implants out of fear, even without symptoms?
Yes, the fear of potential complications leads some to opt for removal as a precaution.
I can understand.
Peace of mind matters.
Definitely. What's the last reason?
Personal choice. People's preferences change over time. They might feel that implants no longer align with their self-image.
Or perhaps they want to embrace a more natural look.
Exactly. It's like, shedding an old layer to reveal a new self.
I like that analogy.
And after removal, there are options to address cosmetic concerns.
Such as a breast lift or fat grafting?
Yes, those can help maintain or improve breast shape after implant removal.
Makes sense.
All about customizing to individual needs.
I was thinking, are there risks associated with not removing old implants?
Well, implants aren't designed to last forever. After about 10-15 years, the risk of complications increases. That's why regular follow-ups are important.
So proactive management is key to minimizing risks?
Absolutely. Keeping a close eye on implant condition helps address issues early.
Definitely.
Prevention is better than cure.
This has been really enlightening. Thanks for walking me through these reasons.
My pleasure. It's important to have these conversations.
I agree. Knowledge is power when it comes to health decisions.
Couldn't have said it better myself. Always happy to chat about these topics.
Well, until next time.